Hello, everyone. My name is Darius Bean, and today I'm going to be giving you my presentation over Alzheimer's disease. So, Alzheimer's disease is the most common form of dementia, and it affects millions of older adults worldwide. In the United States alone, there's approximately 7.2 million people aged 65 and older that are living with Alzheimer's. And as the population continues to age, researchers and experts expect these numbers to increase significantly. Um, and so, we're trying to understand how we can stop these things because, like I said, the statistics are crazy. Like, you see 1 in 9 adults over the age of 65 will be diagnosed, and then also we see a huge um, diagnosis of women more so than men. Nearly two-thirds of the clients that are diagnosed with Alzheimer's are women. So Alzheimer's disease affects not only the individual, but we also see it affect the family, as well as healthcare systems and just communities as a whole. It's one of the leading causes of disability and death among older adults. And like I said, more than 13 million Americans are projected to have it by 2060. And Alzheimer's is not a cheap care cost. Like it is a very long-term care cost that exceeds hundreds of billions of dollars. And a lot of families provide unpaid caregiving, trying to just give their time to their loved ones to help them have a easy way of living and help them through this hard time. So the most recognizable symptoms of Alzheimer's disease is just a decline in memory and thinking abilities. They'll have a very difficult time learning new information, as well as have a problem with communication and language. And then clients are often very disoriented, and they're very confused just how they live. And you see a lot of change in mood, personality, and just behavior. My grandma had Alzheimer's, and so seeing her after she was diagnosed with Alzheimer's and before, it was just like two different people. I mean, she couldn't tell the difference between a remote and a cell phone or a house phone, and then she wouldn't know who you were if you walked the door and asked you 10 times before you even sat down. So the diagnostic considerations, they have a few different steps. So physicians typically try to review a patient's medical history and perform all these cognitive assessments. They conduct some neurological examinations, and then they use some brain imaging, such as MRIs and PET scans. And there's some new blood tests and biomarker research that are making earlier and more accurate diagnosis possible. So hopefully as time goes on, we'll be able to help patients plan ahead and access treatment a lot sooner and maybe see a decline in the progression of these symptoms. So some history behind Alzheimer's. So Alzheimer's disease was identified first in 1906 by a German physician named Alois Alzheimer. Hence the name Alzheimer's. He studied a patient named Augusta Dieter who experienced severe and unusual memory loss as well as some different behavioral systems. And after her death, Alzheimer, he examined her brain and he discovered an abnormal amount of protein deposits and nerve cell damage. And his findings led him to lay down the foundation for over a century of Alzheimer's research. So this is where it all started, and now we're moving forward and hopefully trying to find more and more out thanks to Mr. Alzheimer. So the physiology behind Alzheimer's disease. Alzheimer's disease causes physical changes within the brain, and two key characteristics are the buildup of beta amyloid plaques and tau tangles, which interfere with communication between the neurons and eventually cause brain cells to die. And so over time, these areas of the areas of the brain that are responsible for memory and thinking start to shrink, and this is where you see a lead and um, cognitive declines are associated with Alzheimer's. There's no current cure for Alzheimer's, but there are several medications that can help manage the symptoms. So they use these different inhibitors that may improve the symptoms, may not, but these treatments don't stop the disease, but hopefully they may temporarily slow the symptoms and slow the progression and just improve quality of life for patients and their families as it slowly comes to an end, sadly. There have been some recent and new treatments found. So they've been developing some new treatments to target the disease itself. They've been using these different medications to work by reducing these plaques in the brain, and they've shown some promise in slowing the cognitive decline during the early stages of Alzheimer's. But like I said, researchers are continuing to do intense research and look into people who died with Alzheimer's, look at their brains, and hopefully come up with a plan that can maybe just stop it all and cure it completely once we find out that a patient does have Alzheimer's. Like I said, living with Alzheimer's is very, very difficult. You see daily activities become so much harder. The patients often experience a lot of frustration and anxiety and a huge loss of independence. They're very reliant on the people around them. And then their social relationships just become way more challenging, especially for family members. You know, like my grandma, when she had Alzheimer's, it was so hard for my family because she was like always asked, like, "Who are you?" or like, "Do I know you?" or "Nice to meet you," and stuff like that. And living with her for 10 years of my life and her saying that to me once I walk through the front door is super hard. And so, um, like I said, it's very hard for the patient as well as the family. And hopefully there'll be a disease or a cure one day for the disease, and we'll be able to move forward. I already told you about the impact on families. Here's my references. Thank you.